Another test that we offer that I put a lot of weight in is something called Spectracell and the micronutrient test. Spectracell's micronutrient test is near and dear to me because my doctorate thesis was actually nutraceutical science and Chinese medicine, and I look at the deficiencies of micronutrients in each person's body and what types of symptoms and of course chronic illness those deficiencies can cause. Or at the very least, if they're not causing the problem, they may be related to a problem that they have or be the result of a medication or a certain type of diet or lifestyle, or maybe even a genetic predisposition to have difficulty absorbing those nutrients. So Spectracell is a blood test that we send to a lab in Texas, and over the course of a couple weeks they identify very specific micronutrients that are missing. Nutrients like the complex of B vitamins, our amino acids, our glucose and insulin sensitivity, an immune function score, an antioxidant function score, and a series of antioxidants that may be deficient as well, along with some of the other vitamins like A and D and E and the rest. What we found, and what this lab has found, and what clearly research has found across the board, is very specific micronutrient deficiencies lead to very specific and sometimes very general ranges of disease. And it can be anything from fatigue, ADD, ADHD, insulin resistance, heart disease, memory loss, lack of focus, many different types of symptoms that, when they are put together, correlate into some kind of syndrome. It's one of the first tests that I suggest for people because I find it to be one of the easiest things to fix is a micronutrient deficiency. It may take a few weeks of supplementation, it may take a few months, it may even take a year, but in the end, if we can give each person's body the nutrients that they need to not just be deficient but to be optimal, then the state of health changes. Then we can work with a body that is filled with nutrients and we have something to actually go from. When someone comes into the office and they say, I feel tired, I have no patience for my family and friends, and I just kind of feel weak and I don't sleep right, if we just go right in and say, all right, I want to do 12 acupuncture treatments over the next 4 weeks, and I want to get you on a diet, and I want to see you 3 months after that and see how you're doing. We're going to be working with someone who's inherently deficient and really doesn't even have the nutrient profile to function, and it's certainly not to function at an optimal level, and most likely not able to function at a level that's going to inspire healing. So if we do a micronutrient test, we can see right away, all right, well, this person is deficient across the board in most of their B vitamins. They're insulin sensitive, and they have a genetic marker called MTHFR that shows that they actually have difficulty absorbing B12 and folic acid, two vitamins that will significantly help with energy and improving focus and improving attention and overall general health.